Hi, I wanted to talk today about postnatal thyroiditis. This is a condition of inflammation of the thyroid gland that occurs in some women after childbirth. Now, the reason I want to talk about it is it's becoming increasingly common and it also exists at a subclinical level, and I'll talk more about what that means later. So, what does it do? Inflammation of the thyroid can actually increase activity of the thyroid gland. So when that happens, we start to see symptoms that resemble hyperthyroidism. So this involves things like weight loss, heart palpitations, anxiety, loose stools, and sleeplessness. Now, symptoms such as anxiety and sleeplessness are quite easy to miss in the newborn postnatal time and can often be attributed to postnatal anxiety or depression. So it's really important that you check in with your healthcare provider at that 6-week mark whether your thyroid is in range or not. So the standard treatment for PPT is dependent on your symptoms, and for many women there is often a wait and see approach. However, with these symptoms, particularly in the newborn phase, it's my experience that this is when many women need some form of symptomatic relief. This is where herbal medicine can really shine, because we can use safe and effective mechanisms to dampen that thyroid activity and reduce your symptoms, and treatment can be tailored to whether or not you're breastfeeding. Now, I mentioned earlier about subclinical presentation, and this is basically all the symptoms, but nothing's coming up on your thyroid check. Your doctor says there's no medical reason for you to be feeling like this. However, it's actually possible to have all these symptoms and have your thyroid levels in range, and that's because the thyroid hormone range is actually quite large, so a low for you could be a medium for someone else. Basically, it comes down to supporting you in how you feel and assessing what's normal for you. So if you're having these symptoms, it's definitely worth ruling out thyroid involvement because, like I said, it's becoming very common for this PPT, but it's actually quite treatable, so it's not something that you have to suffer through.